interested in this kind of thing, that they can do it. So
Yeah, yeah. So let's shift gear a little bit now. So we
yeah,
touched a little bit about diagnosis. We talked about this stuff. Um, you were involved with, I mean, you and I sort of got involved a little bit about 20 years ago with artificial intelligence detecting skin cancer with a magnifying device, everything.
right,
But
right.
recently you were involved with this newer device that I think it's got FDA approved. It's Nevisense, right?
Right,
Can you
right.
talk to a little bit about what this technology is and
Yeah.
yeah.
Yeah. So we weren't involved in the initial Nevisense stuff, but we've been working with the device as part of a clinical study, which I'll tell you about. So and I've got no financial conflicts of interest with Nevisense. I can tell you that they loaned us a device for our clinical study, but that I have not received any personal compensation. So Nevisense is a really interesting idea. I was really highly skeptical of it when it first came out, because basically it's a probe that you put on the skin, just kind of like my finger on your skin there, and it passes an electrical current
Yeah.
through this electrode, which is really not much bigger than your fingertip. So from one side of the tip to the other it's passing this electrical current through the skin, and it measures the flow or the resistance through the skin, and it seems to be that it's different in melanoma versus benign skin lesions, melanocytic skin lesions. And they did a very nicely done prospective trial, and they showed that it has a very high sensitivity, meaning that when it's positive, it doesn't miss melanoma hardly at all. I think it was about 93% sensitive, and the specificity was something like 35%
Mm.
specific. So pretty good. And they compared it to the clinician on their own, and the numbers were better. The specificity for the clinicians, is much lower, as we were alluding to with the benign to malignant ratio. If you have about a 35% specificity, it's really like a 3 to 1, and roughly, and not hardly missing, melanoma. So, matter of fact, the sensitivity may have been a bit higher. I'm not sure, but it was definitely in the 90s, maybe mid to high 90s. So the caveat is the FDA approval is that it can only be used in a dermatologist's office. And the
Yeah.
reason is that if you put that probe on something that's not a mole and not a melanoma, well, I should say basically not a mole, because a mole will give you generally a low score. It has a scale of 0 to 10, and moles will be basically 3 or less. But you could put it on a wart, okay, and it'll score like over 3. It'll score like in the melanoma range. But we know it's a wart, so of course we're not worried that it's melanoma. But the reason, there's other things besides warts that people have on their skin that are not so obvious. And if you put this on something that's not in the melanoma family, right? It's not a mole or a melanoma. It can give you a high score, and then you could start biopsying based on that, and you're going to do a lot of biopsies that you shouldn't be doing. And we encountered this in this clinical trial that we're doing, where we said purposefully, we're doing this telemedicine study on spot check, where people can come in. We advertise to the general public in a newspaper. If you have up to 3 spots on your skin, your concern could be skin cancer. Come in, and we'll do our what we call spot check, which is dermoscopy, teledermoscopy, kind of like MoleSafe, but just 3 spots. And then let's do a Nevisense to see if that can help us, even more. And what we learned is that most people come in with things that are not moles or melanomas. They're
Like
seborrheic
seborrheic
keratosis,
keratosis, yeah,
right? Yeah,
most
like warts,
common.
basically,
Yeah.
pigmented warts. Yeah. So Nevisense, we didn't do a formal analysis, but it's like, well, it's probably not so useful in this setting, because it gave us a high number, and we didn't end up using the
So
information.
technically, this too, it's so you need multiple filters and screening. Right?
That's
The
exactly
first
right.
is you got the human being, the expert dermatologist who know that okay, this is I want to differentiate to tell the difference between a melanoma and a typical nevi, not like basal cells, squamous
That's
cells,
right.
pigment decay, warts, all that stuff, right? And then
That's right.
once you pass through the first human filter, and then you put the probe on, and then you
Yeah, and
FDA
then it can be
help you.
useful. Yeah, as a matter of fact, there was a really good study that we would like to replicate, which was in the Sydney melanoma group. Pascal led with Scott Menzies, where they used Nevisense on atypical moles that they normally would follow up 3 months later. So these are these
Mm,
kind of like
yeah.
kind of watch and wait kind of things, because we really don't think they're melanoma, so we're not going to rush to biopsy, but we're going to get a dermoscopy image 3 months after the first one and see if there's change. So they did Nevisense on all of those, and they found that if you raise the threshold for the Nevisense, you can safely manage these patients, and you could go to something like a 90% sensitivity to detect melanoma and something like a 70% specificity.
Wow.
So yeah, they
No,
missed
I
like
think
one.
that is a
Yeah,
really, really valuable thing, right? Because
yeah,
you can imagine, like sometimes you put, you tell the patient, we don't really know, we don't think so, but come back in 3 months. Most patient is like they have that sense of anxiety, right? Especially
yes, that's
like
right.
3 months down hanging around, and but now you have this probe and you can measure it that really sort of can alleviate,
Yeah, yeah,
the,
exactly. Because what they said was, okay, the doctor, the human said come back in 3 months, but if you put the probe on it and it scores 3 or below, they never found a melanoma. So they said, you know what, those people don't even have to come back in 3 months. Even though the doctor thought it looked suspicious, the Nevisense was able to tell them, no, it's okay, you don't have to come back. So that could be a real,
yeah.
again, relieve people's anxiety.
Or
And
even just biopsy at this moment if the Nevisense tells you
that's
much
right.
better.
That was the other thing. If
Yeah.
it scored 7 and higher, they're like, don't come